Hey everyone, this is Hannah with the Rocket Miner giving you today's COVID-19 update. Today in Wyoming we have 648 lab-confirmed cases, 202 probable cases, and 607 recovered cases. So putting all of those together, that leaves us with right around 243 active cases right now for the state of Wyoming. Unfortunately, today in Wyoming, our death count went up again by one. Today, the Wyoming Department of Health reported that another Washakie County resident previously identified as a lab-confirmed case of COVID-19 has died. This man was an older man who had been hospitalized and who was a resident of a Washakie County long-term care facility that was previously identified as experiencing an outbreak of COVID-19. A previous press release from the Wyoming Department of Health said that this facility is the Worland Healthcare and Rehabilitation Center, and this is now the second resident from that center who has died in connection with the COVID-19 outbreak there. They said that the testing they're doing has so far identified 12 cases among the residents of that facility and 9 cases among the staff. As with any of the deaths, every time there's another Wyoming death related to COVID-19, it's just a tragedy and a reminder of how serious this virus is. Again, it especially targets people who are higher risk, especially people over a certain age. So having something like an outbreak at a nursing home or long-term care facility is obviously even scarier because those people are more at risk. And the fact that we've seen 2 deaths now in this one nursing home in Worland is just a tragedy, and it's heartbreaking, and our love and condolences go out to the family and friends of these people who have been lost. And it's just a reminder that we need to continue to take this seriously and take precautions, especially in places like nursing homes. And just continue to do testing and do as much as we can and take as many precautions as we need to keep those people safe. Tomorrow, Governor Mark Gordon is going to be giving another media briefing. This will be at 3 p.m. He'll be speaking again with State Health Officer Dr. Alexia Harris, and they'll be providing an update on where we're at and our response as a state to COVID-19. And a press release today said that the governor will be discussing the status of large events in Wyoming this summer. So going over some of what we can expect and look forward to as a state regarding the kinds of large events that we normally see during the summer and how those may be changed or different expectations for those. Thinking about things too, like the large events that we have during the summer, like fairs and other things, is also connected to the tourism in Wyoming that brings people in usually to our state. And tourism is actually Wyoming's second largest industry, so it's hugely important to our state. It's an important source of revenue. And obviously COVID-19 has had a huge impact on tourism. And I just thought it was interesting. I was looking over some of the stories that we've shared recently, and we've been sharing some stories from the Associated Press and from other Wyoming newspapers that discuss tourism in Wyoming, how this pandemic has affected it, and kind of the different expectations and uncertainties as we go forward concerning that. There was a story that's on rocketminer.com now, you can read it, that's from the Gillette News Record. And in the story, they interviewed several people in Gillette who are owners of motels or museums, people who have been affected by the impact that COVID-19 has had on tourism and who are expecting that impact to continue for their businesses and their industries, and just talking to those people about how it has affected them so far and what they're expecting going forward. And there is a lot of uncertainty. I thought it was interesting. The story was talking to the Rockpile Museum director, Robert Henning, and he said that he's not sure what to expect this summer. And the museum is one of the places that a lot of the traffic they get is actually people from out of town who are just passing through and stop at the museum to see what they have. And he said that he's not really sure what to expect for their tourism season. He said for their museum, a tourism season might never really come this year. But he said it's also possible that maybe people are going to want to travel after having been cooped up for 2 months. So there's just this uncertainty of, are people still going to be worried about COVID-19, so therefore they won't want to travel? Or for people who've been cooped up and now things are reopening, is that going to want to be them getting out and going to do something because they haven't been able to for so long? And I think there will probably be a mixture of both of those responses, but it will be interesting to see what impact it has. And most of the people that were interviewed in that story specifically were very hopeful, saying that this is going to be hard and it's going to take a while to come back from, but they're still hopeful that the tourism industry will be able to recover and come back and be strong again. But again, there's just so much uncertainty about how this summer is going to affect it and where things are going to go with that. There's also an interesting story we shared that's in Associated Press story about Yellowstone and the reopenings there and what national parks are doing and what they're expecting as far as enforcing the guidelines of social distancing for people who are visiting. There are so many stories about people in Yellowstone who pet the bison when they're not supposed to, or who fall into the hot springs and get injured. And it's almost this stereotype now that people who go to Yellowstone don't really have common sense, especially a lot of the out-of-state or foreign visitors and tourists from other places who just don't know these safety things but don't pay attention to the safety precautions in place. So there was this discussion of if we can't get people to have common sense normally when they visit Yellowstone, are they going to have common sense when they visit and there are all of these restrictions because of the virus? And how do you enforce that? And they were talking with the people at Yellowstone, the Yellowstone superintendent, Cam Shawley, and he said, we can't keep the public away from bison and bears every year at full staffing levels. So the notion that we're going to keep every human being 6 feet apart is ridiculous. So basically he's taking the opinion that there's just no way to actively enforce that. So they said that park officials are planning to let the public mostly police itself against the disease. And they're putting up signs and they put the rules and the precautions in place, but they're basically saying as far as enforcing that goes, it's just going to depend on the people who are there, whether or not they follow those guidelines. And the Yellowstone staff isn't necessarily going to be able to enforce that all the time. And there was discussion of other national parks and the approaches that they're taking and the attitudes that they're taking on whether or not they'll be able to enforce these guidelines and these restrictions. But it is interesting to note, they also said that if too many coronavirus cases associated with the park emerge, Yellowstone can shut down again. And the park is working with health officials to coordinate plans and test employees for COVID-19. So they're doing as much as they can, but hoping that the people who visit will follow those guidelines themselves, because if they don't, and if cases spike again, we could just have a shutdown and go right back to where we were before. And obviously all of this ties into the bigger discussions that are going on with COVID-19, with rules and guidelines and enforcements, and what can we enforce and what do we just have to leave up to people to do themselves. And it's definitely an interesting discussion on so many different levels relating to people's rights and their freedoms, but also just how much do we do to protect other people that could be at risk because of this if people don't follow the guidelines on their own. So it's definitely an interesting ongoing discussion, and there are a lot of factors to consider. But as always, I just want to encourage people that we need to listen to the different sides of the arguments, and we need to understand and be kind and be compassionate and open-minded and willing to listen to the different arguments. And then for people who are concerned about the people who aren't following the guidelines, that can be frustrating and can be something you worry about, especially for people who are immunocompromised and are worried that if other people aren't following these guidelines, the virus is just going to keep spreading and it could affect them and seriously impact their health or their life. So there are a lot of different perspectives to keep in mind. But I think it's important for all of us to remember to just do what we can personally and make sure that you're doing your part and you're following the guidelines and you're doing your best to keep things safe and to keep other people safe. And yeah, just be part of the discussion and listen to the arguments from all sides. But remember to stay kind and to just do your best that you can personally. Thank you for listening. We'll keep giving you more news and updates. Have a good day.